next?
Let's go over to
Okay.
Dr. Fab from Liverpool. Now, you're doing an anti-aging treatment, would you say?
That's right, Stephen. Once we all get beyond our mid-30s, what happens is the eye socket opens out and downwards. We lose some bone off our cheekbones, we lose some mid-face fat, which will, in some people, cause jowl formation, drooping of the tissues. In Simon's case, it manifests itself as when he smiles,
Yeah, look
although
at
he's
that.
had Botox around here, you can still see these zygomatic lines, and that's the action of this muscle, zygomaticus major, which makes you smile against the volume loss. If I go nuts with Botox here, we're going to give him a wonky smile, but by replacing lost volume, we're going to disguise the appearance of those lines and also lift the tissues a bit.
So does the lifting effect actually create a volume appearance? It'll actually
It does. I mean,
extend
one of
out
the
and make us-
characteristics of a youthful face
Okay.
is volume, nice curves.
Dr. Fab, let's see the results, because you've treated one side of the face already.
Sit Simon up. So I've just treated the left side of Simon's face, and what we can see if we look at him straight on is that the cheekbone on the left is higher, we have more volume, it looks better under the eye, but smile, we can see less zygomatic lines on this side than this side.
So, in terms of the results, do people need to come in for a top-up treatment at all?
Yes, I mean the results, as you can see, are instant, but sometimes it can be and then some, because fillers can cause swelling. The injection technique with the candy can cause a bit of swelling, so I always review them 2 weeks later to make sure that the result is right. I usually give them a bit of a top-up.
And how long will it last?
We should get a year out of this, but
Oh,
sometimes longer, because when you stretch tissues, it can stimulate fibroblasts to produce collagen, so don't be surprised if you get more than a year out of it.
So if you keep getting them in, will it build up over time enough that you wouldn't need it?
Yes. And you'll find that with repeated treatments, you'll need smaller volumes, and the intervals between treatments will extend.
So yeah.
Dr. Fab, do you want to just do some injections for us before we move on? And I'll ask Simon how it feels.
It looks, you can really see. I mean, you look like you have a high cheekbone now.
That's good.
It's very exciting.
To ensure Simon's safety in this procedure, I'll be injecting not with a needle, but with a cannula, which is blunt. So I need to make a nick in the skin with a normal needle, just to get it through. And that's our cannula.
Wow. Ooh. So laboratory looking.
And the advantage of this is because it's
So you're
blunt,
gonna go right back in that same hole.
because it's blunt,
Wow.
no bruising, it's not cutting anything, and also there's no danger of being inside a blood vessel. You accidentally inject filler into a blood vessel, it can be catastrophic.
Does that hurt, Simon?
No, it's a funny feeling, but it doesn't hurt.
Okay.
So I'm now just fanning this filler. See, through that one entry point, I can reach around a lot of the face.
You're sitting on top of the muscle,
With under the skin,
under the skin.
subdermal. And then once I've done this, I'm going to be coming into the cheek and using the cannula, we're going to put some filler in the mid-face, which will help under the eye, and then I'm going to reach up to here, and then just put a bit more volume over
So it's
his
almost like
cheekbone.
threading it in different angles.
Right,
to
we're
pull
going to
it
let
up.
you carry
Wow.
on here, Dr.
Fun.
Fab. We're going to move on to Lauren from Juvia
Love it.
Aesthetics.